MedShake.
Hi, I'm Anca, and this is the place to be to hear about the latest tech trends in healthcare. Today, we're diving into a topic that might just redefine how we think about patient care. What if I told you that video games could do more than just entertain? That they could be powerful tools for healing, therapy, and patient engagement? Welcome into the Metahealth. What if learning about a disease was as engaging as playing a video game? Research suggests that gamification in health education significantly improves patient understanding and adherence. A randomized trial involving 375 participants aged 13 to 29 found that those who played Remission, a game designed for young cancer patients, maintained higher levels of chemotherapy in their blood and adhere more consistently to their antibiotics compared to a control group. Beyond cancer, gamified apps for asthma, diabetes, and even heart disease are demonstrating measurable benefits. A meta-analysis of 7 studies with 657 patients found that gamified apps led to significant improvements in physical activity levels, HbA1c, which is a marker of blood sugar control, and self-management empowerment among individuals with diabetes. Similarly, patients with heart failure who use these apps showed enhanced disease knowledge. Now that we've explored how gaming can be used for education and disease management, let's take a closer look at how it supports patient engagement and treatment. One of the biggest challenges in healthcare is keeping patients engaged with their treatment. Let's face it, taking medication, attending therapy, or sticking to a rehabilitation program isn't always fun. That's where gamification comes in. Studies show that adding game-like elements, think progress tracking, rewards, and challenges, can boost adherence to up to 30% in chronic disease management programs. Imagine turning your diabetes management into a rewarding quest. Instead of just logging blood sugar levels, you get real-time feedback, challenges, and incentives that keep you motivated. Sounds better than a spreadsheet, right? Now let's look at another example. Pain. We all know it's an unavoidable part of medicine. But what if we could trick our brain into feeling less pain without a single pill? That's exactly what some groundbreaking VR games are doing. Take Snow World, a VR game designed for burn patients. Research shows that while immersed in the game, patients experience pain relief comparable to taking opioid medications. Additionally, a study from Cedars-Sinai Medical Center reported that patients using VR experienced a 24% reduction in pain scores, highlighting VR's potential as a non-pharmacological pain management tool. And it's not just VR. Simple mobile games like Angry Birds have been shown to reduce anxiety and pain perception during medical procedures. It's the ultimate mind hack, and the results are quite fascinating. That brings us to the next challenge, recovery. Rehabilitation can be grueling, but what if it felt more like an interactive adventure? Motion-based gaming platforms and VR rehab programs are making therapy more engaging and also more effective. Studies show that stroke patients using gamified rehab tools recover motor skills 20% faster than those using traditional methods. Parkinson's patients using VR balance training show significant improvements in coordination. So the takeaway, when therapy feels like a game, people stick with it and they get better results. And speaking of therapy, let's talk about mental health. Serious games, which are games designed for education or therapy, are making waves in the mental health treatment. And no, I'm not just talking about meditation apps. Take Sparks, a video game designed to deliver cognitive behavior therapy for adolescents with depression. Clinical trials found it to be just as effective as in-person therapy. And brain training apps like Lumosity are being studied for their potential to improve cognitive function in older adults at risk of Alzheimer's. We have a full episode about the positive impact of gaming in mental health, so make sure to check that out. So the big question here is, could gaming be the future of therapy? The science suggests that we are heading in that direction. Of course, gaming in healthcare isn't all about power-ups and bonus points. There are challenges to overcome. First, accessibility, because not everyone has a high-end gaming system or VR headset. Then there's privacy, as always. Gamified health apps collect a ton of data, so protecting patient information is a major concern. And finally, there's this balance between fun and medical efficacy. The best health games aren't just entertaining, they need to be scientifically validated. But despite these challenges, one thing is clear: gaming isn't just for entertainment purposes. It's becoming a legitimate tool for healing, recovery, and mental well-being. As the technology continues to evolve, the line between medicine and gaming will only continue to blur. That's it for today. As always, I will see you soon for another tech adventure in healthcare.